For week 11, we have JS, who is a 23-year-old female with a history of anxiety and depression, who presented to psychiatric emergency services due to SI. She is in treatment with a therapist currently right now, and also she sees a psychiatrist, and she was just started on ketamine, the nasal spray version, which is called Spravato. She has no acute medical problems or on any other current medications. She reports that she drove to St. Joe's partial hospitalization program yesterday, but found out there was a 2 week wait list for the program. She also called several other psychiatric partial hospitalization programs, but they also have a wait list for several weeks. She said that she doesn't feel like outpatient treatment is enough right now. She decided to present to the psychiatric emergency services because of her difficulty accessing a higher level of care. She notes that her close friends are also very worried about her. She reports worsening anxiety and depression, which she attributes to several recent life stressors. She just graduated from U of M with a degree in history this past spring. She started a temporary virtual job, which ended in August, as a video game designer. And also, she recently broke up with her partner of 1.5 years 2 months ago. She has also been questioning her gender identity, and she thinks that the breakup just hit her 2 weeks ago. Um, Her SI, she says, has just recently gotten really strong since then. She notes that the relationship was, quote, unhealthy. She endorses current suicidal ideation, stating that it has been as frequent as 2 times daily, and also that it was all day yesterday. Her suicidal thoughts become, quote, really strong after she broke up with her partner 2 months ago. And she also has a plan of overdosing on a bottle of Rimmon, but she denies a current intent. She also has thought of several other methods, such as a car accident, getting hit by a car, drowning, or using a knife. She says that she would not actually attempt suicide until 1 year after the breakup, and 1 year from now, because she does not want her suicide to be associated with a breakup from with her partner. She denies any past suicidal attempts. She does report some recent self-harm, however, including scratching herself and pinching herself, and also holding a knife up to her arm. She also mentioned calling the suicide hotline, quote, multiple times in a row recently. And in terms of protective factors, she mentions spite, her family, and other short term future goals. But however, she doesn't see a long term future for herself. She states that her depression is adversely affecting her function. She explains that at her job, even though it's virtual, she's doing the quote the bare minimum end quote, and she reports poor sleep, about 5 to 8 hours, and she has to use cannabis and melatonin. Also, her appetite has been decreased significantly. Um, she denies, however, any history of mania or psychosis or homicidal ideations. She reports using alcohol several times a month, about 2 times a week, and she also has been using cannabis daily. She denies any other substance use. She explained that she doesn't feel like her family accepts her, which she has been discussing in therapy. She does identify as homosexual queer, and she also reports a history of, quote, a non consensual sexual experience about 4 years ago, but she's discussing in therapy, and unfortunately, she's just recently starting to experience some flashbacks because of that. We were able to get some collateral information from her therapist, who recommended a voluntary psychiatric admission or a partial hospitalization program. Um, so she, besides the ketamine, even though she was prescribed the Remeron, she was not taking it. She complains that she didn't want to be on an antidepressant. When it comes to her mental status exam, her appearance, she was fairly groomed, but she was appropriately dressed. She had good eye contact every now and then, but at times it was avoidant. But there were no tics or tremors noted during the interview. Her demeanor was pleasant. Her speech was normal. Her mood was very depressed, and she was definitely very tearful during the interview. Her thought process was linear and goal oriented, and she did deny any homicidal ideations, but she does have active suicidal ideations. Um, Her orientation, she was A&L times four. Her attention was intact, and also her concentration was intact. Her impulse control is fair, her insight and fair, and her judgment was fair. So the plan for her, she's going to start a partial hospitalization program when the room becomes available in 2 weeks. But in between then, or until that room becomes available, she's going to meet with her therapist twice a week. Okay, thank you.